Hello everybody and namaste. My name is Ganga. Welcome to my channel. First of all, it's been a while that we all are facing this pandemic situation. I think it's been nearly 2 months, and hope everybody's keeping safe, healthy, and maintaining social distancing. So today, guys, I'm continuing the second part of my Q&A video. र फर्स्ट पार्टमा चाहिँ मैले मेरो आफ्नो एन्सर्सहरू राखेको छु हैन, जुन चाहिँ मेरो फ्रेन्ड्स एन्ड फ्यामिलीहरूले सोध्नु भएको थियो, जुन चाहिँ अब यो पेन्डेमिक यो कोभिड रिलेटेड छ हैन। हजुरहरूले हेर्नु भएको छैन भने म त्यसको लिङ्क चाहिँ डिस्क्रिप्सन बक्समा तल राखिदिन्छु। अनि आज चाहिँ मैले त्यही प्रश्नहरू जुन चाहिँ मैले एन्सर्स गरेको थिएँ त्यो चाहिँ मेरो साथीहरूको, मेरो नर्सेस साथीहरूको, मेरो कलिग्सहरूको पर्सपेक्टिभबाट सुनौँ भनेर मैले यो भिडियो बनाइरहेको छु हैन। मलाई धेरै साथीहरूको एन्सर्सहरू आछ है, र मेनी अफ यु आर स्टिल इन्ट्रेस्टेड हैन, तर समयको बावजुदले गर्दाखेरि अब सबैजना बिजी हुनुहुन्छ, त्यो भएको भएर अब सायद पठाउन सक्नु भएको छैन हैन। इट्स ओके, वी अलवेज हेभ नेक्स्ट टाइम एन्ड वी क्यान डु दिस कोलाबोरेटिभ टाइप अफ भिडियो अर एनी काइन्ड अफ प्रोजेक्ट इन फ्युचर। र आज चाहिँ जति पनि मलाई एन्सर्सहरू प्राप्त भएको छ मेरो कलिग अनि मेरो नर्सेस फ्रेन्डहरूबाट, आइ एम सो इगर टु पुट इट फरवर्ड एन्ड इट्स सो इन्ट्रेस्टिङ टु हियर फ्रम अदर नर्सेस पर्सपेक्टिभ एज वेल rather than only me or only one person. And I'm so thankful for all of you for being part of it. So without further delay, let's start our second part of Q&A and hope you will enjoy it. And guys, if you are interested to know all the answers that my nurses, friends and colleagues gave, then please do keep watching this video till the end. What it is to be a nurse for you at this pandemic?
गङ्गा बहिनी चाहिँ एउटा साह्रै राम्रो प्रोग्राम बनाएको रहेछ, Q&A फर फ्रन्टलाइन हेल्थ प्रोफेसनल भनेर। यसमा चाहिँ 8वटा क्वेसनहरू छ, जसमा चाहिँ उसले फर्स्ट क्वेसनमा के भनेको छ भने वाट इट इज मिन टु यु बी अ नर्स एट दिस पेन्डेमिक सिचुएसन है। सिचुएसनले मेरो प्रोफेसन एज अ नर्समा चाहिँ कुनै चेन्ज भएको छैन। म पहिला पनि आफूलाई एज अ नर्स भेरी भेरी प्राउड फिल गर्थेँ, अहिले पनि त्योभन्दा बढी फिल गर्छु। तर सेम टाइम आइएम स्केयर एज वेल, किनभने म एज अ मम अनि त्यसपछि वान अफ द होइन अब फ्यामिलीमा अब हेल्थ केयर सेक्टरमा काम गर्ने पर्सन, त्यसपछि अब सधैँ हस्पिटल गइरहनु पनि, काम गर्नुपर्ने, कोभिड पेसेन्टहरूसँग डिल गर्नुपर्ने भइरहेको कारणमा चाहिँ मलाई चाहिँ सेम टाइम प्राउड फिल भए पनि इनसाइडमा चाहिँ अलिकति स्केयर एन्ड वरी चाहिँ हुन्छ है। त्यो भन्दैमा चाहिँ मलाई म नर्स किन भएँ भनेर चाहिँ अहिलेसम्म रिग्रेट चाहिँ भएको छैन। अलिक डर लाग्छ काम गर्ने ठाउँमा, तर हामीसँग प्रपर पिपिई भएको कारणले चाहिँ म स्पेसली आइटीमा काम गर्ने भएको कारणले वी हेभ अ प्रपर केयर।
Pandemic is not an easy situation, very difficult. As a nurse, I think I took this pandemic as an opportunity to serve humanity. आफ्नो पेसेन्टको मात्रै नभएर एज अ नर्स हामीले चाहिँ आफ्नो फ्यामिली, फ्रेन्ड्स, कम्युनिटीलाई चाहिँ नि डाइरेक्टली सर्भ गर्ने मौका पायौँ। आफूले जानेको कुराहरू सेयर गर्ने, आफू कसरी यो पेन्डेमिकको टाइममा चाहिँ आफू कसरी जोगिने फ्रन्टलाइनमा काम गर्दाखेरि र अरूलाई कसरी चाहिँ नि बच्ने भन्ने कुराहरू चाहिँ नि हामीले सेयरहरू गरेर होइन धेरै कुराहरू सिक्ने अनि सिकाउने मौकाहरू पायौँ। त्यसैले I really take this pandemic as an opportunity to learn more and put our learning in practice, and I always feel really proud. I know we lost of life.
Nursing right now is a very important role. I am very proud to be a nurse right now. Ideally, I chose to be in this profession. This profession wasn't handed down to me. It wasn't forced upon me. I have always wanted to be a nurse all my life. And I think that during this time nurses have a very tough role to play, because we are caring for other people's loved ones. We are the ones that are there morning and night. We're there 24 hours, 7 days a week, being that first point of contact for your loved ones. And that for me is so rewarding because we are there to help them and make them feel comfortable and provide them with any reassurance, guidance, or support that they may need, as well as their medical needs.
I haven't basically practiced as a nurse in UK, but I have been dental nurse for more than 10 years now, and I really love my job as it involves dealing with the people. I haven't experienced any face-to-face COVID patients, but what I have been doing is triaging all those patients who need a dental help over the phone and guiding them, advising them, and in worst case scenario, if they need any sort of help, then calling the dentist and asking them to help. That's what I have been doing with the peoples. I feel very grateful that I'm a nurse and I'm able to help others in many ways.
How does your family take you being a nurse at this period, especially at this time?
Family, they're obviously worried, especially my parents, अनि मेरो अरू फ्यामिलीहरू, एक्सटेन्डेड फ्यामिली जो चाहिँ नि सबैजनाले मलाई दिनदिनै फोन गरेर तिम्रो फ्रन्टलाइनमा काम गर्ने हो, सेल्फ आइसोलेट गर्नु 14 दिनसम्म, काममा नजानु भनेर चाहिँ नि धेरैजनाले सजेसन गर्नुभयो. आई क्यान अन्डरस्ट्यान्ड हाउ दे वर वरिड अबाउट मी, बट मैले चाहिँ के भन्थेँ भने उहाँहरूलाई 14 दिनसम्म त म सेल्फ आइसोलेट गरेर बसौँला होइन, तर 14 दिनपछि अझै सिचुएसन वर्स हुनसक्छ, अनि त्यति बेला चाहिँ म के बाहना बनाएर बस्ने भनेर चाहिँ मैले उहाँहरूलाई भन्थेँ. सो it was in a funny in a way that my parents who taught me not to lie all my life were telling me to lie because of the pandemic. So I think
फ्यामिली वरी नै फ्यामिली नै हुने हो है. अब सबैजना मेरो मात्रै फ्यामिली न, हामी सबै हेल्थ प्रोफेसनलको फ्यामिलीहरू इन दिस सिचुएसनमा चाहिँ अब सबैजना वरि भइरहनु छ. स्पेसली आफ्नो देशभन्दा टाढा भएर देख्न नपाउँदाखेरि चाहिँ त्यो वरि चाहिँ झन् बढी हुन्छ. मेरो बुवा मम्मी नेपालमा हुनुहुन्छ, मेरो सासु ससुरा अमेरिकामा हुनुहुन्छ, मेरो बुढो सासु ससुरा पनि हुनुहुन्छ नेपालमा. सबैजनाको चाहिँ टेन्सनै त्यही छ कि रन्जु हस्पिटलमा काम गर्ने, त्यसमाथि आइटियु नर्स सधैँ, अनि इङ्ल्यान्डको न्युजहरू सुनिरहने, अनि मान्छे यति मऱ्यो उति मऱ्यो भनिरहने, अनि सबैजनालाई चाहिँ टेन्सन त्यही हो. अनि एभ्री डे दे कल, अनि त्यसपछि मेरो हस्बेन्डसँग उहाँहरूको कुरा हुन्छ, स्पेसली म काममा भएको बेलामा पनि, म काममा नआएसम्म, कामबाट नआएसम्म र मेरो स्वर नसुनेसम्म पिर भइरहन्छ.
Currently, my family are very, very supportive. They're there if I need anything. I can call them at any time of the night. They were actually really proud when they heard that I was going to be nursing in a COVID hospital. They were very worried. They asked, did I really want to do this? And I don't know, without hesitation, my only response was, of course I want to do this. This is my job. This is what I chose to do. This is who I chose to be. And I want to do it for others, not just for myself.
At this pandemic situations, my husband, I told him that, I will be registering myself as a volunteer to help in, people in this pandemic situation. His first reaction was no. After I, slowly explained to him how important is it and how so many doctors and nurses are doing this. So as a human being, I think I should do this and help other people. And I got the skills. So if I have got the skill and I can use that skills to save someone's life, I think I should do it. And then he agreed to it. And then obviously I, volunteer myself. I fill out all the application form. But unfortunately, I have been called so far.
What is the first thing that comes to your mind when you go to work, guys?
फर्स्टमा म मेरो केही दिनको एनुअल लिभ पछि 12 मार्चमा काममा आउँदाखेरि चाहिँ नि काममा अलिअलि यो COVID-19 को चाहिँ नि हल्ला भइसकेको थियो. अनि मैले चाहिँ यदि केही भइहाल्यो भनेदेखि चाहिँ नि म आफू चाहिँ नि यहीँ काममा नै एकोमोडेसन मागेर बस्छु र म चाहिँ नि मेरो आफ्नो परिवारको लागि र आफ्नो यहाँ बिरामीहरूको लागि चाहिँ नि रिस्क बन्दिनँ भनेर चाहिँ मैले एउटा मेन्टालिटी बनाइसकेको थिएँ। अनि त्यसरी नै अनि यहाँ वार्डमा चाहिँ नि अब वार्डहरू कसरी म्यानेज गर्ने, अभियसली अब स्टाफहरू सिक निकै हुन्छ होइन, स्टाफिङहरू कसरी गर्ने। अनि मेन चाहिँ अब पिपिईहरू हामीले नर्मल पिपिईहरू मात्रै चलाइरहेको, खासै स्पेसल हाम्रो त्यस्तो सप्लाईहरू तयारी थिएन। अनि त्योहरू चाहिँ कसरी गर्ने भनेर चाहिँ हाम्रो अब मेट्रोनहरूसँग कुरा भयो। अनि त्यसपछि बिस्तारै हुँदै हामीले चाहिँ नि छुट्टै एउटा आइसोलेसन वार्ड पनि छुट्टै बनाउने भन्ने कुराहरू भयो। र त्यही हो, हामीले चाहिँ नि कसरी म्यानेज गर्ने भन्ने कुरा नै हामीले चाहिँ सुरुमा सोच्यो र अनि म्यानेजमेन्टले पनि त्यही अनुसार नै सपोर्ट गर्यो हामीलाई। स्टाफहरूलाई धेरैसम्म त ट्रान्सपोर्ट दिएको थिएन, तर एन्ड अफ मार्चतिर चाहिँ ट्रान्सपोर्टहरू पनि दियो। र अनि एकोमोडेसन चाहिँ हामीलाई सुरुदेखि नै जो चाहिँ यहाँ बस्न चाहन्छ उहाँहरूलाई चाहिँ एकोमोडेसनहरू दिएको थियो, विच वाज गुड।
Every day, the thoughts that cross my mind are: 1, how many patients are we going to have? 2, how are my colleagues going to cope? And 3, have there been any deaths, which is really sad. To work in that environment, you need to have a very supportive team, and you also need to be able to communicate with them. So if you have any worries, any distresses, like, it does impact others, so you really need to be mindful. And it's really hard because if you're having an awful day and you go into work and, you know, you're awful to everybody that you work with, it doesn't make a very good work environment. So that's the thing. So if you see somebody that's struggling, you need to know how you can support them, as well as being able to support the patients. You have to support your colleagues because you're a team, you all work together, and you know, you can't do it without each other because everybody needs somebody. You need to be able to recognize the signs of someone struggling also. And you know, like, it depends if your patients are sedated or not sedated, or you know, you also need to be able to recognize the signs for them if they're struggling, because you need to be able to offer support to them also. These times are testing, people are going to struggle, and I think that's the most important thing. At this moment, we are learning how well we need to communicate with each other. And the thing is, our communication skills have become amazing during this time, and you know, people are willing to speak to each other. You know, they're not bundling things up, which is really good. And obviously it's awful because it has taken a tragedy of a disease for us to be able to communicate with each other when we should have been able to do that before. Personally,
पहिला पहिला काममा जाँदाखेरि चाहिँ एकदम रमाइलो लाग्थ्यो कि अब आफ्नै काम हो होइन, आफ्नै ठाउँ हो। अनि त्यसपछि वर्क सेम होइन, अब आई बिन डुइङ दिस फर लाइक लङ टाइम नाउ, इट्स बिन 10 years। अनि मलाई थाहा थियो कि कस्तो खाले सिचुएसन ह्यान्डल गर्ने, कस्तो खाले सिचुएसन आउँछ, कसरी डिल गर्ने भन्ने सबै अब एक्सपिरियन्स भइरहेको छ र भइसकेको छ। त्यसपछि अहिलेको सिचुएसन, यो COVID-19 चाहिँ जुन नयाँ सिचुएसन, नयाँ भाइरस, हामीलाई केही थाहा छैन। अनि सबैजनालाई उसै त डर भइरहेको ठाउँमा, स्पेसली हाम्रो हस्पिटलमा चाहिँ इट्स लाइक अ जेनरल आइटियू बाहेक हाम्रो 4वटा आइटियूहरू क्रिएट भएको छ, कोभिड आइटियू भनेर। अनि हामी लाइक अल द नर्सेस, वी डोन्ट नो वेयर वी गोइङ होइन। यो 4वटा आइटियूहरूमा चाहिँ हामी चाहिँ स्क्याटर भएको छौँ अहिले। स्पेसली कुनै दिनमा कुन आइटियूमा, कुन दिनमा कुन आइटियूमा भएको कारणले चाहिँ एभ्री मर्निङ वेन आई गो टु सिफ्ट, आज म कुन चाहिँ आइटियूमा हो, अब कोसँग काम गर्ने हो, स्पेसली अब आफ्नो वर्क टिमहरू चाहिँ, अब आफ्नो जुन कलिगहरू चाहिँ सँगसँगै काम गर्दा जुन रमाइलो, जति नै बिजी भए पनि रमाइलो हुने जुन इन्भाइरोमेन्ट हुन्छ, त्यो चाहिँ अहिले सुरुमा त थिएन, अहिले त भइसकेको छ। स्पेसली अब दिन प्रतिदिन काम गर्दाखेरि चाहिँ अब मान्छेहरू चिन्ने होइन।
Has this COVID-19 personally affected you?
कोभिडले मलाई एफेक्ट गर्यो गरेन, नट स्योर। किनभनेदेखि सुरु डे 1 देखि नै हाम्रो कोभिड सस्पेक्टेड पेसेन्टहरू चाहिँ नि हामीले हेरिरहेका थियौँ विथ नो प्रपर पिपिई आफ्टर अ विक अर सो मलाई चाहिँ नि अलिकता जिउहरू दुख्ने रिङ्गाटा लाग्ने त्योहरू भएको थियो अनि एक दिन चाहिँ म एकदमै धेरै रिङ्गाटा लागेर अनि त्यति बेला चाहिँ मेरो टेम्परेचर पनि अलिकता टेम्परेचर अब 37.6 हो त्यस्तो थियो होइन अनि त्यसले गर्दाखेरि म चाहिँ नि के भन्यो भने आई डोन्ट वान्ट टु रिक्स आई वान्ट सेल्फ आइसोलेट फर 7 days भनेर चाहिँ म घर गएको थिएँ त्यति बेलासम्म स्वाबको पनि त्यति साह्रो व्यवस्था भइसकेको थिएन त्यसैले गर्दाखेरि चाहिँ नि म 7 days आइसोलेट गरेँ अनि त्यो 7 daysमा मलाई खासै त्यस्तो सिम्टमहरू वर्स भएन तर मेरो खोकी चाहिँ अलिअलि थियो अनि तर त्यो खोकी चाहिँ स्टिल कन्टिन्यू 2-3 हप्ता जस्तो चाहिँ त्यो खोकी भइरहेको अनि त्यसपछि म काममा आएपछि चाहिँ नि मलाई स्वाब गरेको थियो अनि त्यो स्वाब चाहिँ मेरो नेगेटिभ आयो होइन सो आई क्यान रियली से my GP was saying like might be like mild symptom so I should isolate and I did refer to 111 as well and they said I should self-isolate so
COVID-19 hasn't affected me with any of my family members, thank God, but I had a mild version of it, but I recovered from it and it was all okay. But I know some work colleagues have had it and they have been pretty sick with it, but they have recovered. And I've also come across some patients that are in the health professional, which is really sad because you try and put yourself in their shoes, in their position, and you think, wow, that could have been me. And it's awful to think because these people are doing the same thing that you are. They're fighting the fight and they get sick in the process. And I've come across a lot of work colleagues that have had colleagues that are severely sick and are in intensive care, and they have to pull through and they have to work through it and they have to treat other patients. And it's hard because you have to learn to set your emotions aside from your work emotions because you have a job to do, and at the end of the day we're all human and we're all allowed to feel things. I think it's important to remember that you know, if you have a bad day, it's okay. You don't have to be ashamed about it. You can let your emotions show and hopefully.
Of course it's affect me. जुन चाहिँ नर्मल लाइफ त जुन वर्किङ प्याटर्न जुन सोसियल लाइफ होइन अब फ्यामिली लाइफ एभ्रिथिङ हेज बिन अफेक्टेड मेरो मात्र होइन सबैजनाको एफेक्ट भएको छ स्पेसली म चाहिँ एकदमै सोसियलाइजिङ गर्नुपर्ने मान्छे आजभोलि अब यो लकडाउन त्यसपछि यो होइन वर्किङ प्याटर्नले गर्दा चाहिँ अलि अस्तव्यस्त भएको छ म घरमा आउँदाखेरि पनि अलिकति जुन कामबाट आउँदाखेरि जुन एक्साइटमेन्ट घर फर्किन्छु अब डाइरेक्ट आएर फ्यामिलीसँग बच्चाहरूसँग हक गर्ने त्यो पनि होइन अब हक गर्ने उनीहरू आउने बित्तिकै आएर बस्ने त्यो पनि गर्नु पाएको छैन अब स्ट्रेट आई हेभ टु गो टु सावर होइन अब काम गरेर आएर त्यसै ठाउँबाट अब टच गर्न नै पाइँदैन अनि बच्चाहरूलाई एकछिन वेट गर भनेर आई हेभ टु बी फ्रेस फर्स्ट अनि अलिक डिफ्रेन्ट भएछ चिन्ता लाग्छ त्यस्तै गरेर हामी मेरो फ्रेन्ड सर्कलबाट चाहिँ हामी होलिडे जाँदै थियौँ यो मेमा स्पेसली वी अलवेज go every year as like a ladies holiday and we really you know enjoyed ourselves यो वर्षको लागि पनि हामीले मेमा चाहिँ हामीले प्लान गरेका थियौँ त्यो पनि जान पाइएन अनि अब बाहिर साथीभाइहरूसँग सोसियलाइजिङहरू हुन्छ साथीभाइहरूसँग हाम्रो भेटघाट भइरहन्थ्यो त्यो पनि हुन पाएको छैन it has affected I think it has affected everyone.
Yes, you know, the first when I hear about the news, coronavirus spreading over, you know, old wild, and you know, seeing the figure of the people are dying and the infected persons, I feel, you know, I feel so sad and very emotional, and it affects me mentally. We never has to face this situation before, so obviously I'm sure no one has faced this situation in their life, and this is the first time we are facing this type of situation where we don't know what will be the solution is. So we're just going according to the signs and symptoms and saying, okay, we will do this to relieve fever, we will do this medication to relieve the symptoms, but actually we don't know the cure for it. So it's very scary if you look at this.
Is there any moment, guys, that you have broken down emotionally, and can you share?
Emotionally breakdown, yes, of course. I work in a nursing home, and the nursing home situation is different than the hospital, little bit, because we know our residents longer, and obviously you get to know them longer, and you are a bit attached with them as well as the family. So especially talking about the COVID end of life care, it was difficult to talk to the patient and the family because they were not allowed to come and stay around with their loved one. So it's not easy all the time normally, and especially at this pandemic time was even difficult. And putting yourself in their shoes.
So many times I have broke down. There was a one day, I think it's a couple of weeks ago, म चाहिँ लङ डेमा थिएँ. त्यसपछि मेरो पेसेन्ट चाहिँ स्पेसली मेरो पेसेन्ट चाहिँ एक्चुली हि वाज डुइङ भेरी वेल होइन. अनि त्यसपछि मैले चाहिँ भेन्टिलेटेड पेसेन्ट थियो, तर अब एक्सट्युबेट गरेँ उसलाई चाहिँ. एक्सट्युबेट भइसकेपछि वी डु एक्सट्युबेसन आफ्टर द्याट दे रियली डु वेल होइन. अनि त्यसपछि ऊ चाहिँ त्यो म चाहिँ एकदमै खुसी भइरहेको एउटा अवस्था थियो. तर त्यति बेलामा चाहिँ मलाई के गर्नु पर्यो भने आई हेभ टु बी इन्टरप्रेटर. एकदमै यङ मान्छे चाहिँ COVID-19 को कारणले चाहिँ बितेको थियो, जसको चाहिँ फ्यामिली लाइक एकदमै यङ फ्यामिली, लाइक 5 months ओल्डको बच्चा, त्यसपछि 5 years ओल्डको बच्चा भएको केटा चाहिँ जस्ट हि वाज ओन्ली 26, हि डाइड. एन्ड देन आई हेभ टु इन्टरप्रेट. अनि त्यो दिन मलाई एकदमै हेभी फिल भएको थियो. अनि लकिली आई डिड नट हेभ टु गो थ्रु ऑल द्याट. एन्ड त्यसपछि बट thinking even to go there and talk to the वाइफसँग कुरा गर्नको लागि चाहिँ जाने त्यो सोचाइ अनि त्यसको त्यो प्लानमा चाहिँ मलाई अलरेडी इन्भल्भ हुँदाखेरि नै मलाई गाह्रो भइसकेको थियो. तर मैले आफूलाई सम्हालेर आई हेभ टु बी देयर भनेर, अदरवाइज नो वान विल होइन एक्सप्लेन द्याट सिचुएसन टु द लेडी. इन्डियन थियो अनि मैले चाहिँ एक्सप्लेन गर्नुपर्ने अवस्था आएको थियो. त्यो सँगसँगै अर्को पनि हाम्रो आफ्नै नेपाली बहिनीको हस्बेन्ड, मलाई फोन आयो. त्यसमा एउटा अर्को चाहिँ फोन आयो. उसले चाहिँ मलाई उसको हस्बेन्ड, दे जस्ट गट म्यारिड लास्ट इयर, आई थिङ्क कपल जस्ट 1 year को कपल. अनि हस्बेन्ड चाहिँ COVID-19 को कारणले चाहिँ लन्डनको अर्को हस्पिटलमा एडमिट भएको. अनि कुनै पनि खबरहरू राम्ररी त्यति साह्रो नपाएको. उसले चाहिँ एक्सप्लेनेसनहरू अब डक्टरको थ्रुबाट केही नपाएको अथवा नबुझेको होइन. अब धेरै दिन भइसक्यो भनेर ऊ चाहिँ एकदमै स्ट्रेस भएर मलाई फोन गरेको रहेछ. मैले पर्सनली त्यो बहिनीलाई चाहिँ चिन्दिनँ, तर आई ट्राई टु फाइन्ड आउट होइन. बट अनफर्चुनेटली आई कुडन्ट फाइन्ड आउट हाउ हि वाज. मैले अरू साथीहरूलाई पनि भनेर ट्राई गरेँ. अनि त्यो दिनमा चाहिँ मैले यो डिल गर्दाखेरि चाहिँ मलाई एकदमै गाह्रो भएको थियो. त्यसपछि मैले कामबाटै फोन गरेँ. मेरो एउटा एकदमै मिल्ने साथीलाई फोन गरेर आई ब्रोक इन टियर्स. अनि त्यसपछि अनि कामबाट फर्किँदाखेरि पनि मैले मेरो आफ्नो अर्को साथी सुनिता, जसलाई चाहिँ मैले कल गरेँ. अनि यो सिचुएसन उसलाई पनि एक्सप्लेन गरेँ. अनि त्यसपछि लाइक सेयर गरेपछि चाहिँ म अलिकति इमोसनली चाहिँ सपोर्ट पाएँ मेरो साथीहरूको थ्रुबाट चाहिँ. इट्स भेरी भेरी हार्ड डे.
Do you ever regret being a nurse?
Never, no. I always feel proud. I always wanted to be a nurse, and I will never ever regret being as a nurse.
Facing everything, what are you grateful for most, and what do you hope for?
It's not very nice to have this kind of situation, But I think I'm grateful because you can see how people cope with this kind of pandemic and emergencies, and lots of people doing good things, like charity, raising the charity for PPE, helping others.
Very nice question. Grateful, of course. I have a lovely family, family, friend circle, and especially our supporting colleagues. I'm very grateful for them. Every situation ma, मेरो hard time ma, मेरो emotional breakdown ma, साथी दिएको दिने साथीहरू छ, फ्यामिलीहरू सधैँ मेरो बारेमा चिन्ता गरेर सुतिरहनु हुने फ्यामिलीहरू हुनुहुन्छ. आइ एम भेरी भेरी ग्रेटफुल टु देम. अनि होप चाहिँ के भने अब अहिलेको समयमा यो ठप्प रोकिरहेको संसारलाई चाहिँ फेरि यो COVID-19 भन्ने भाइरसलाई चाहिँ निर्मूल बनाएर फेरि we want to go back to our normal life, and I hope it will gonna happen soon.
Facing everything what's happening now has taught me a great lesson that you need to enjoy your life every second. You don't know what's gonna happen next, so don't care what others says, as they have always something to say. So the way I look at is that the things have changed. The way I used to look before and the way I used to look my life is completely changed. I just want to enjoy my life, and I spend most time with my husband and my son because they are my family. So this has really changed it. It has made me a very, very positive person, which I'm loving it.
Do you have any advice for the people who are suffering at home?
My suggestion for this pandemic, or after pandemic, I think we all have learned a lot after this pandemic situation. I think we still have to carry on with your good hand hygiene and social distancing. Don't expose to yourself unnecessarily. Even we didn't get this coronavirus, this virus will be still around us, and many other viruses will be still around us. So we all have to be very cautious, and everyone have to stay safe.
अहिलेको सिचुएसनमा चाहिँ यो कोभिड हामीलाई आई थिङ्क सबैजनालाई लाग्ने वाला छ अथवा लाग्छ पनि होला हैन. कसैलाई माइल्डली लाग्छ होला, कसैलाई चाहिँ भेरी भेरी अब ब्याडली एफेक्ट गर्छ होला. त्यही भएर तर लाग्दैमा अब माइल्डली एफेक्ट हुँदैमा लाग्दैमा चाहिँ मरिहाल्छु भनेर सोच्नु भएन. मेन कुरा चाहिँ पोजिटिभ, इफ यु हेभ अ पोजिटिभ इनर पावर, अनि आफूसँग चाहिँ मलाई केही हुँदैन, मलाई यो रोग लाग्दैमा चाहिँ म मर्दिनँ, त्यसपछि म आफ्नो लाइफस्टाइलमा चाहिँ म हेल्दी वेमा चाहिँ बिताउँछु. त्यसमा चाहिँ आफूले हाइड्रेट हुनु पर्यो, राम्रो खानाहरू खानुपर्ने भयो, रेगुलर एक्सर्साइजहरू छ भने घरमै पनि गर्न सक्छ अहिलेको लकडाउन सिचुएसनमा. त्यसमाथि अनि माइल्ड सिचुएसनहरूमा माइल्ड सिम्टम आउँदाखेरि प्यारासिटामोलहरू खाने, अब इनफ रेस्ट हैन, त्यो गर्ने. त्यसपछि मेनली चाहिँ आज भोलि चाहिँ धेरै कुराहरू मेडिटेसनहरूले अनि योगाहरूले चाहिँ धेरै हेल्प पनि गरेको छ. यसमा चाहिँ इमोसनली यसले चाहिँ स्ट्रेस आउट गर्छ. फिजिकली स्ट्रेस छ भने अब रेस्टहरू गर्नु पर्यो, राम्रो न्युट्रिसनहरू खानु पर्यो. अब इमोसनली अब स्ट्रेस हुन्छ भने त्यो मेडिटेसनहरू गर्ने, योगाहरू गर्ने, आफूलाई मन परेको कुराहरू गर्ने, त्यो गर्दाखेरि चाहिँ धेरै राम्रो हुन्छ. म यो अवस्थामा चाहिँ के भन्न चाहन्छु भने त्यही हो, सबैभन्दा ठुलो कुरा चाहिँ मन हो. मनलाई बलियो बनाउने. अब रोग लाग्यो भन्दैमा पहिले खुट्टा नतान्ने. आफ्नो परिवारमा कोही छ भने पनि उसलाई चाहिँ बेटर लुक आफ्टर गर्ने. जस्तै अब पहिलाको भन्दा अब बेसी अब हुन्छ नि, अब मान्छेहरूमा चाहिँ फिजिकली मात्र नभएर यति बेलामा चाहिँ इमोसनली पनि सपोर्ट चाहिएको हुन्छ. त्यही भएर आफ्नो परिवारमा कसैलाई केही भएको छ भने पनि इन हाउसमा, आई मिन लाइक हुन्छ नि, अब आउटसाइडमा जानु भएन, आफ्नै परिवार अब भएको छ भने चाहिँ एकले अर्कालाई हेल्प गरेर इन हाउसमै प्रपर केयर गर्नु पर्यो अनि इट विल बी ओभर आई होप थ्याङ्क यू
The best medicine for this, I have realized, is your strong mentality. If you are very positive and you got very strong mentality, I don't think so anything can touch you. So please be strong. If you need any help, if you are emotionally down, if you are mentally down, there are so many helpline available, so you can definitely speak to them, and I'm sure they will show you a right way, a right path to handle these situations in a very positive manner. I hope everyone recover from this nightmare very soon. I also hope everything will be over very soon. At last, I want to say thank you to all the people who are staying home, saving life, saving NHS. Together, definitely we can fight these battles, and I hope everything will be over very soon.
So next answer is from Hangmarai, says staff nurse working in NHS Trust. So she sent me this beautiful message. Soon she knew I was doing Q&A. That's so kind of her. So let's hear what she wants to convey to us. She says, as I enter my workplace, I feel like entering a war zone, a battlefield where I know for the next 13 hours I will be relentless fighting for the battle, for the safety of others. I prepare myself mentally and tell myself that these 13 hours I might not be able to eat and drink at all, and therefore I should keep myself going strongly with love and compassion in my heart. And this helps a little bit. That's so beautiful, Hangma, and thank you for being so strong and doing the great job. And she continues, but the worst part is not entering the workplace. It is leaving the workplace and going home to my family and risking their lives because of me. Since the pandemic, I'm only praying that I don't bring virus at home, and I pray God to protect them. That's so beautiful. And that's the situations that we all frontliners are facing right now. But we have to do what we have to do. And she continues, while everyone is applauding for NHS staff, I would like to pay highest respect and gratitude towards the family like mine who are going through this tough time yet being so supportive and so strong. And thank you all the family members for helping us frontliners and being so strong for us, being so supportive. And Hangma, I'm so grateful for your messages, and I really appreciate that you made an effort to send me. Thank you, Hangma. So next answers is from my beautiful friend Silva Acharya. She's sister in one of the NHS Trust. So she kindly sent me all the answers according to the number. So I'm going to read it through. If I answer her all the answers according to the number, then it might take a while. So I'm just going to read it through what she has to share with us. So the first thing she says is that being a nurse in this pandemic is just like going to the war without being trained. Sometimes you feel like you are waiting for symptoms to appear on you and you will die soon. Secondly, she says, this time my family think this is the worst job. Every time I come home, they will be worrying getting jumps again. That's really true feeling. For the third answer, she says, about 4 weeks ago, I used to think when I come to work that how many patients do we need to move up to ITU? And second thing that I used to think was, would I be getting infected myself? You know, that's really true answer. Silu, thank you so much. And for the fourth answer, she says, yes, it has affected me personally because it has affected the entire work-home balance. I have seen many people sick and dying. It's getting worrying every day, coping with children at home and not even able to go on booked holiday. That's really true for everyone. Life has been affected. And for the fifth answer, she says, yes, I have broken down at work when 54 years old man died with cardiac arrest at 3 p.m. Well, I have referred him to ITU team at 3 a.m. I think it looks like she referred eat before 12 hours. And she says the man who died had 3 young children and felt that the death was preventable. That's really sad. And seeing young ladies 27, 52 getting poorly overnight and needed ITU admission. For the 6th answer, she says, well, I do regret being a nurse. I want a job wearing high heels, nice outfit. However, I cannot think of any other job because I've never done it. Actually, Silo, I love your answer because you are straight and you are pure. You know, sometimes when you are stressed, this kind of feeling comes and goes from our mind because we go to this wasteland. I wish I was doing this. I wish I was doing that. But at the end of the day, we end up being a nurse again because that's what we have done and that's what we love to do. So that's a pure feeling and that's real feeling. So it's okay to have that kind of feeling sometimes. So that's it, Silo. But I am so proud of you for what you are doing as a friend, and I'm sure that you are proud of yourself as well. So keep doing what you're doing, okay? Okay, so let's go for the... And lastly, she says, I'm grateful to save lives of others and hope it will end soon. And whoever is suffering from symptoms, please buy oximeter if you can. And this is giving silent hypoxia without breathlessness. If not, seek medical advice. I think what she meant is that, whoever is suffering from symptoms to buy oximetry, which is one of the medical device that monitors oxygen percentage in your blood. And with COVID patient and, who are suffering, may have low oxygen percentage in your blood. So obviously that is going to monitor your oxygen percentage in your blood, which is called oxygen saturation. So if that happens, then obviously you can easily seek medical advice. And she also advised to eat nutritious food. Well, this is so lovely answers and very helpful to everyone, I think, and helpful to me as well. And thank you, Silo, for taking time for answering all those answers, and I'm so grateful for you. Thank you, Silo. Have a good day. Last but not the least is our dearest sister, Asa Gurung Didi. So she's a practice nurse as GP practice, and I love the way actually she sent me these answers. It's precise, it's short, sweet, and very clear to read. So she says, very anxious and fear as we cannot plan, but I feel proud to be nurse. And for the second question, she says, family are more worried and sad due to the situation. Small children are more confused, needed to explain and more about pandemic and having difficulty to make them understand as it is complex. For the third question, we asked about what is the first thing that comes to your mind, and she says, what am I working in today? So I think what she meant is that which departments you'll be allocated to. I'm not sure how it works in practice, GP practice, but in hospitals what happens is that when there's a scarcity of staffing level in the unit like ITU and COVID allocated areas, then nurses are allocated in those areas sometimes. So that doesn't mean that you'll be working in the same ward that you have been working. Sometimes you are reallocated in different unit as well. This is a situation right now. It's a pandemic, so we have to accept whatever is going around. So I'm not sure what she meant, but I think that's what she meant. Anyway, let's go for the fourth question. For the fourth question, has this COVID personally affected to you? And the answer is that yes, my childhood friend lost her husband. Well, actually, this is really sad to hear, Didi, and I hope that your friend is doing all right and you are in touch with her. I'm so sorry to hear this. Okay, so let's move forward for next questions. For the sixth question, she says, do you ever regret being a nurse? And she says, no, I don't. I feel proud to be nurse. Yes, Didi, I am proud of you as well. And the seventh answer, she says, hope for the healthy and no more deaths. And she also advised to follow government guidelines and don't be afraid to ask for help and keep washing your hands. That's so true. So everyone, keep washing hands. And Asadidi, thank you so much for your precise, clear, short and sweet answer. And I love it. And thank you for being part of this, Q&A. And hope to see you soon. Stay safe, stay healthy. Thank you.